Hi, I'm Sanjay Majumdar. I'm a plastic surgery consultant from Yorkshire in the UK. And for this Medicine in a Nutshell talk, I thought we'd talk about syringes, needles, and intravenous cannulae, which are commonly called Venflons after a trade name in the UK. So syringes come in a very wide range of sizes. As you can see, this one's a 1 ml syringe, so this entire thing just only holds 1 ml. All the way up to 60 mils. The most commonly used ones are 10 mils, 5 mils, 20 mils. So you've got a wide range of sizes of syringes. Now, the other thing about syringes is that the tips actually vary. So these are just normal tips where the needle will just plug into like that, and you take your needle out. While you've got these other tips which are called luer lock, which is essentially screwed in. So if you do that, you need to screw that in, and that's actually quite secure. This is a blunt tip needle, so it won't hurt me. That is nice and secure, and sometimes we want to use that. Now, there's some other syringes available. There's this one, which is not really used for intravenous work. It's called a bladder syringe, and this fits into things to wash out. So larger tubes, if you want to wash out something surgically, that's a bladder syringe. You can see the tip is somewhat different from these and tends to be much larger. Then there's the insulin syringes, and the insulin syringes actually have an inbuilt needle, so that the needle's right as integral part of the syringe, and it goes up to a much smaller calibration. It gives you units of insulin as you're drawing up, and the needle is very, very fine indeed. And this is for diabetics when they're injecting themselves with insulin. And the final type of needle is, syringe, I apologize, is this here, which is got what we call a reverse luer lock. So unlike this, where you've got the luer lock on the inside, this has got a reverse or female luer lock, and that fits into tubes and so for enteral feeding. So again, not for IV, but for feeding patients through a nasogastric tube and so on. So that tends to be used in a different setting. So let's talk about needles. Now, these are the needles that we used attached to syringes for intravenous medications or for injecting local anesthetic, anything of that sort. Now, needles come in